This essay will explain common problems of the male reproductive system. Of the female reproductive system, it is made for nursing students preparing for the Nclex exam. It is also for anyone who wants clear and simple health information. We will look at each health issue in a specific way. First, we will describe the symptoms. These are the signs that something is wrong. Next, we will explain the common causes. Understanding why something happens is an important step. Finally, we will outline the actions to take. This includes what you can do and when you must see a doctor. The structure we will use is symptom, cause, action. This method helps to organize complex information. It makes the details easier to learn and to remember for a test. It also makes them easier to use in real-life situations. This approach builds confidence. It helps you think like a nurse. The main symptom of erectile dysfunction, or ED, is trouble getting an erection firm enough for sex. Another common symptom is difficulty keeping an erection during sexual activity. Some men with ED also notice a reduced desire for sex. These physical symptoms can lead to stress, anxiety, or a loss of self-confidence. These can create tension in a relationship. It is important to know that occasional trouble is normal. ED is when it happens consistently over time. There are many causes. Problems with blood flow are a major factor. Conditions like heart disease and atherosclerosis. Nerve damage can also cause ED. Diabetes, multiple sclerosis, or pelvic surgery. Hormone imbalances, such as low testosterone, contribute as well. Lifestyle and mental health matter. Smoking, heavy alcohol use, drugs, being overweight, and inactivity. Stress, anxiety, depression, and relationship problems can all play a role. The fear of failure can itself create a cycle of anxiety and failure. The most important action is to talk to a doctor or a nurse practitioner. They will ask about your history and perform a physical exam. They may order blood tests to check for diabetes, low testosterone, and high cholesterol. Changing your lifestyle is key. Quit smoking, reduce alcohol, eat healthier, and exercise regularly. For many men, these changes improve symptoms. Other treatments include medicines like sildenafil or tadalafil, vacuum devices, or sometimes surgery. If you take an ED medicine and have sudden vision or hearing loss, seek urgent care. The symptoms of benign prostatic hyperplasia, or BPH, are related to urination. Weak stream, stops and starts, trouble initiating, post-void dribbling. Frequent urination, especially at night, nocturia. A feeling of incomplete bladder emptying, cause natural enlargement of the prostate with age. It is benign, not cancer. As it grows, it squeezes the urethra, narrowing flow like a pinched hose. If you have symptoms, see a doctor. A DRE helps assess prostate size and shape. Urine tests for infection and blood tests for kidney function may be done. Mild symptoms, watch and wait. Lifestyle changes like fewer fluids before bed. Medicines. Alpha blockers relax prostate, bladder, neck. Others shrink the prostate over time. Severe cases may need surgery. If you suddenly cannot urinate at all, this is acute urinary retention. Go to the ER. Prostatitis symptoms often involve pain. Pain in the perineum, lower belly, groin, or lower back. Painful urination or ejaculation. The symptoms of premenstrual syndrome, or PMS, are physical and emotional. They appear 1 to 2 weeks before the period begins. Mood swings, irritability, sudden sadness, and increased anxiety. Bloating, breast tenderness, fatigue, trouble sleeping, headaches, and cramps. Symptoms start before and resolve within a few days after the period starts. Main cause, hormonal fluctuations after ovulation. Estrogen and progesterone shifts. Hormonal shifts can affect serotonin, influencing mood, fatigue, and cravings. High stress, not enough sleep, and a poor diet can worsen symptoms. First action, track symptoms with a simple diary for a few months. Core management, regular exercise, healthy diet with more fruits, vegetables, whole grains, and reduced salt, sugar, and caffeine. Prioritize sleep. OTC pain medicines can help with cramps and headaches. For severe symptoms, options include hormonal contraception, and for mood symptoms, SSRIs. If you have thoughts of harming yourself, seek urgent medical or mental health help immediately. The main symptom is bleeding that is not normal, heavy bleeding, menorrhagia, bleeding between periods, and irregular cycle lengths. These indicate a problem with the normal pattern. Common cause, hormone imbalance of estrogen and progesterone. Uterine fibroids or polyps can contribute. thyroid issues, clotting disorders, and pregnancy-related problems, including miscarriage. If bleeding is unusually heavy or at odd times, see a doctor. Evaluation includes a pelvic exam, hormone and anemia labs, thyroid testing, and often pelvic ultrasound. Treatment depends on cause: hormonal therapy, pills or hormonal IUD, iron for anemia, surgery for fibroids or polyps when indicated. Emergency: extremely heavy bleeding with dizziness, weakness, fainting, or a very fast heartbeat. Go to the ER. Do not assume it is normal. Early evaluation leads to better outcomes. The most common symptom of endometriosis is pain, often severe during periods, worse than normal cramps. Pain can occur at other times: chronic pelvic or lower back pain, pain during or after sex, pain with bowel movements or urination, especially during the period, heavy menstrual bleeding or spotting between periods. Sometimes the first sign is difficulty getting pregnant. Cause: tissue similar to uterine lining grows outside the uterus. It can involve ovaries, fallopian tubes, outer uterus, bladder, or intestines. This tissue thickens, breaks down, and bleeds monthly. The blood becomes trapped, causing inflammation, severe pain, and scar tissue called adhesions. The exact reason it occurs is not fully understood. If you have severe symptoms, talk to your doctor. Diagnosis starts with your history. A pelvic exam may detect tenderness or nodules. Ultrasound may identify ovarian endometriomas. The only way to be certain is laparoscopy, allowing direct visualization. Treatment focuses on pain and symptoms. OTC pain relievers help mild discomfort. Hormonal treatments reduce monthly buildup and pain: pills, patches, vaginal rings. For fertility goals or severe cases, surgery may be recommended. Laparoscopic surgery can remove lesions and adhesions. Safety sign: sudden severe pelvic pain not relieved by usual medicine could indicate an ovarian cyst problem. Seek urgent care. A tailored plan with your clinician can restore function and quality of life. Many ovarian cysts cause no symptoms and are found by chance, often during a routine exam or an ultrasound for another reason. When present, dull ache, pressure or fullness, sometimes on one side. Bloating. Irregular menses or abnormal bleeding. Pain with intercourse. Most small, simple cysts resolve within a few months without treatment. Most cysts are functional, related to normal ovulation. A follicle may not release an egg and enlarge, or a corpus luteum may seal and fill with fluid. Other types include dermoid cysts, cystadenomas, and endometriomas from endometriosis. Main action for small, simple, asymptomatic cysts: watchful waiting with repeat ultrasounds. Mild pain, OTC analgesics. Recurrent functional cysts: birth control to suppress ovulation. Surgery if very large, persistent, atypical on imaging or causing severe pain, often laparoscopic. Emergency: sudden severe pelvic pain with fever, vomiting, dizziness or weakness, possible rupture or ovarian torsion. Seek immediate care. Most cysts are benign and manageable with monitoring and timely intervention. Knowing when to seek help is the most important part of managing your health. For any new, severe or worrying reproductive symptom, see a nurse or doctor. Do not wait and hope it will go away. Early evaluation leads to simpler treatments and better outcomes. Schedule a visit for painful periods, changes in urine stream, or trouble with sexual function. Go to urgent care for inability to urinate, sudden severe abdominal or pelvic pain, very heavy bleeding, fainting or rapid heartbeat, or high fever with pelvic pain. Prevention: healthy weight, balanced diet, regular activity, do not smoke and limit alcohol. Be open with your provider about sexual health and concerns. Use protection like condoms. STIs can cause problems such as prostatitis and pelvic inflammatory disease. For Nclex prep, use the symptom, cause, action framework. Create cards: symptom, cause, action, then add diagnosis steps, treatments, and critical safety alerts. Remember red flags and prioritize immediate interventions and physician notification. For everyone, these signals help you take control of your health. Effective treatments are available. There is no need to suffer in silence. A conversation with a trusted provider can start your recovery. Be proactive in study and health. Simple strategies and timely care work. Understanding these conditions, their symptoms, causes, and actions empowers you.